We have to give it 30 seconds, although it says live streaming, okay? By the way, do you guys see Delegate Ken Care? Do you see how he spelled the name? All right. Good afternoon, everyone. Welcome to the, this is our voting list number 5 for the Health and Government Operations Committee. We do have 8 withdrawals. Is everyone okay with that? All right. 1 second, please.
Move the withdrawal.
Second.
They've been moved and second. Are there any concerns? Although, okay, all those in favor say aye.
Aye.
Any
Aye.
opposition? Seeing none. Oh, Delegate Taveras, your hand is up.
Just voting.
Okay, great. Wonderful. So all those in favor say aye.
Aye.
Any opposition? All right, they are withdrawn.
Madam Chair,
Gonna go, yes.
could you tell me, so is Delegate Kipke, is he absent or excused, or so I can have it for my notes as
He's excused.
he's excused? And
Yeah.
just so I can see, so all the other of my minority members are on?
Yes, they are.
Thank you very much. Appreciate it.
Yeah, I see Morgan. Where's Morgan? 1 minute.
I see. Okay. I see
He's there.
Matt.
Wait, yep, everyone is here. And I see
are.
Chisholm, Shalega, everyone's here.
I'm on
Thank
for
you.
now.
Okay,
And
thank you.
Hutchinson is right there in the middle. So all your buddies, all our friends, they're not just your buddies. They're here, okay?
Thank you.
My pleasure. So let's go to the first bill. That is House Bill 111. And that is actually Aaron and Bagnall. Will you be so kind, Aaron? This is the Maryland Medical Assistance Program, Maryland Children's Health Program, and Social Services Programs, eligibility and enrollment. Aaron, can you tell us what's in the bill?
This bill requires the Maryland Department of Health by January 1st, 2025 to establish an express lane eligibility program to enroll individuals in Medicaid and the Maryland Children's Health Program based on eligibility findings by the Supplemental Nutrition Assistance Program. There are amendments in your packet that were adopted in the Public Health and Minority Health Disparities Subcommittee. The amendments clarify that MDH may propose or implement the use of express lane eligibility for renewals before proposing or implementing its use for initial enrollment, and it strikes the remainder of the bill that was related to the Department of Human Services, SSI, and Human Energy programs.
Delegate Bagnall.
Thank you, Madam Chair. We had a really great discussion on this bill. We had Trisha Roddy from Medicaid who came, as well as we had a representative from SNAP who explained to us the programs, the safeguards, and how these two eligibilities would interact. It was not a unanimous vote in subcommittee because there were still outstanding questions, but the members did indicate that they just wanted more information.
Okay. So are there amendments? Do you want to move them and then we discuss it?
I move the amendments.
Is there a
Second.
second? It's been moved and second. Are there any concerns or discussion regarding this bill before we take a vote on the amendments? Okay, yes, Delegate Shalega.
My questions aren't on the amendments. I think the amendments are good. Do you want me to just hold until you
Yes,
finish the
thank you.
amendments?
Thank you. Delegate Taveras.
What was the difference in cost between the original proposal and what's being proposed now? Or the cost savings?
Do you want me to take it?
Yes.
Now we're down to 144,000. And then it would be whoever qualifies, but the cost of whoever qualifies, but these are people who are otherwise eligible for Medicaid. We're just capturing people who are currently eligible anyway.
Okay, thank you.
Okay. Any other questions? I have anyone else? All right. So the amendments have been moved and second. All those in favor say aye.
Aye.
Any opposition to the amendments? Delegate Shalega, your hand is up. Is that for a question? Okay. I see no oppositions to the amendment. On the bill as amended, may I have a motion?
So moved.
Second?
Second.
It's been moved in second. Any discussion? Delegate Shalega?
Now I think I'm in the right track.
Yes.
So-
Thank you.
My question is on security. So, you know, there have been articles about stolen food stamps. You know, there's some cybersecurity issues going on. So I'm very concerned about sharing data. So what assurances do we have that you're protecting people's data?
Delegate Bagno?
Thank you, Madam Chair. When we brought in our experts, they did speak about the safeguards that were in place, the review policy. SNAP actually has
I'm gonna have to
a
rein her
review
in.
policy of every
You
6
don't ask
months
that
as
question.
opposed to Medicaid, which does a yearly review, although they do an off-cycle redetermination for any change in circumstance. SNAP spoke to their access to the Department of Labor reports. And they would have a data share agreement, which currently this program already sort of, it exists in that SNAP currently can use Medicaid eligibility to determine SNAP. They just can't do the reverse, which is what this bill does.
Okay, well, I still remain very concerned about that because of the fraud that's been taking place. And additionally, how is it going to impact when we qualify everybody for Medicaid? Now, are they going to take SNAP benefits away when they don't qualify anymore?
No, because the only eligibility for this express lane is if you are eligible for both programs under the federal poverty level. So you would have to be eligible for both programs in order to utilize the express lane.
It's not an automatic enrollment. I thought that's what the bill did.
It's not an automatic enrollment because there is under federal law, you have to affirm that you want to be enrolled. There is some leeway that is given to the states as to how to have that affirmative step, but federal law requires that you cannot automatically enroll without affirmative consent.
But again, that doesn't answer the question about unenrolling. So if somebody in Medicaid re-enrollment is unenrolled, will they then be unenrolled from SNAP? Will it send a notice to SNAP saying you're now not eligible for SNAP?
No, it doesn't unenroll. It only streamlines the process so that you don't have to fill out, both applications that you have. That if you're eligible for both programs, you can utilize the express lane. And the bill was amended at the request of Medicaid to look at redeterminations first, re-enrollments first, and then to set up a secondary process for new enrollments.
That was my question about re-enrollment. Okay. I'm still concerned about data sharing, so I'm going to vote against it.
Okay. And I said, I know I made a comment, I wasn't muted. It is not a cost saving, Delegate Taveras, if I may clarify. We're not doing a lot of the things that were in the bill. We got rid of a lot of the things that were in the bill. It's very, very limited, very, very limited. Okay. Thank you. Go ahead, Delegate Chisholm.
Thank you, Madam Chair. And I appreciate this actually goes back pre-Chairman Bagnell, all the way back to Chairman Kelly. And we did do a lot of work, and I appreciate all the work that the sponsor was willing to do to try to appease a lot of my concerns. And I understand the impetus of the bill is to make things more streamlined. I just still feel like there's way too many pitfalls and that people will be involuntarily enrolled. And if we really want to make things easier, shouldn't that impetus just fall on Medicaid to make the application process easier rather than having people involuntarily or on accident showing up on Medicaid. That was my whole point. So I will not be voting for this bill, but I appreciate the intent.
Thank you. And again, it's as we say in ideological difference, right? So we're going to respect it. But it is very limited, what we're doing here, actually. I would have preferred the whole thing the way it came in, but that's me personally, right? But I respect your position. And I know that's what Delegate Taveras was getting to, but I understand where you're coming from. But as you know, we have to compromise, right? To get some of these bills through. And this was a big compromise here, especially with the cost. Delegate Bagno.
Thank you, Madam Chair. And I just wanted to speak to that too. This compromise was actually the sponsor of the bill was the one who offered the compromise initially, because one of the pitfalls wasn't just the cost. It was that because this relationship already exists between Medicaid and SNAP, they thought doing a reverse process would not be challenging. But when we involved other agencies, it got a little more complicated as well as more costly.
So, Delegate Chisholm, that is actually a good bill when we're all not satisfied, but we're going to do a little something. But I respect your view. It's good. Any other questions or concerns? Okay. So it's been moved and second. Let's do it so that it's easier for staff and I. All those in favor say aye.
Aye.
Okay, so anyone opposed, will you be so kind and raise your hand? The little whatever color you have for your hand. All right, so I have Morgan, Chisholm, Riley, Hutchinson, Shalega, right? Am I missing someone? And okay, 5. There you go. Okay, thank you so much for a healthy discussion. Next, we have House Bill 172, Delegate Kerr, and that is Lindsay and Rosenberg.
This bill authorizes a licensed athletic trainer to perform dry needling as a specialized task if the athletic trainer is approved by the Maryland Board of Physicians. The board must issue an approval to perform dry needling to a licensed athletic trainer who meets specified requirements. There are amendments on page 2 of your packet that conform the bill to the Senate cross-file as it passed the Senate. The amendments strike an erroneous cross-reference, alter the instruction requirements under the bill to require the hands-on instruction to be completed under the guidance rather than supervision of a licensed healthcare practitioner, and specifies that the instructor be approved to perform dry needling, and clarifies that the assessment must be performed by the course instructor. These amendments were considered in the Health Occupation Subcommittee, and for everyone's reference, I know that Delegate Kerr also has a technical amendment that was circulated as a separate document from the amendment packet, which was not considered in subcommittee.
Madam Chair.
Yes.
As Lindsay pointed out, this bill, well, before the technical amendment, is identical to the bill that passed the Senate 44-1. It passed the committee unanimously, and we trust Delegate Kerr. I would urge the body to trust Delegate Kerr.
Because he cares, right?
Absolutely.
Okay, great.
So how do you want to act? You want to move the amendments we adopted first?
Why don't you move the amendment and get a second?
So there's two amendments that I have.
Delegate Woods, will you be so kind and mute yourself? Thank you so much. So Delegate Rosenberg, Delegate Taveras, we're going to move the amendments first, okay? And then we're going to discuss
amendments that were acted on in subcommittee.
All right.
Second.
And they be moved in second. So now we'll open it up for discussion. And on the amendments, the 2 amendments, are there any concerns or discussion?
Question.
Yes, Delegate Hill.
Lindsay, the difference between supervision and guidance, was it stronger or less strong?
I would think that supervision is stronger.
So it's now
that would be my take as well.
So it's now changed to guidance. Okay.
Mm-hmm.
So it's less. And what did this do to the opposition? Where are they with all these amendments? Are they still in opposition?
No, the amendments are acceptable to to the parties.
The opposition is neutral. They're now in favor of the bill.
That's my understanding, yes.
I'm sorry, it was a question. They're neutral or they're in favor of?
They support the bill. They no longer oppose the bill.
Thank you.
Sure.
Thank you for your questions and thank you for clarifying it. Are there any other concerns? Delegate Taveras, you're okay?
Yeah, no, it's just that this must be the amendments that came out of committee, and there's a new one by Delegate Care. So we'll set that aside and we'll just work on the subcommittee amendments first.
Okay. Actually, these are the amendments that we have here. There are no others.
No, the technical one is the one that says page 2, line 3 and 4, strike or mechanical device. Is that the one?
Oh, so
Yes, so it was circulated as a separate document. The amendment packet was like 4 attachments. And so the amendments from subcommittee were on page 2 of the amendment packet. And then Delegate Kerr's technical amendment was circulated as a separate document in, I guess, a 5th email for the voting session.
And that's the one that is amendment number 113827/1, the one that's basically on page 2 in line 3 and 4 is strikes or a mechanical device, correct?
Right.
Okay, is that the one you're referring to, Delegate Taveras?
Yes.
Okay, so let's vote on the other 2 that we had, right? That we just moved in second. So is there any other discussion on those other 2 that Delegate Hill just asked some clarification, some questions? Delegate Kurt, you have questions about those 2 that we just discussed with Delegate Hill?
Just a point of clarification.
Yes.
The guidance language was suggested by the Board of Physicians.
Okay, thank
Thank
you.
you. That helped.
Any other questions regarding those 2? Seeing none, Delegate Kurt, will you be so kind and thank you. Seeing none, all those in favor of the amendment say aye.
Aye.
Any opposition, raise your hand. I don't see any hands that are opposed to it. Now on the amendment that was circulated, amendment number 113827, which on page 2 in lines 3 and 4 strikes or a mechanical device. Delegate Rosenberg, do you want to address that?
This is a technical amendment offered by the sponsor, and my understanding is it's acceptable to all the parties. So it was not, however, to be, considered by the full subcommittee, but I would move favorable.
May I have a second and then
Second.
we'll have discussion. It's been moved and second. Discussion, Delegate Taveras, this is your time. You have any question about that one?
No, ma'am.
Okay, Delegate Ken Care, any questions?
Thank you, Madam Chair. This came in this morning from the acupuncturist. They requested this change. We ran it by the athletic trainers and they were fine with the language, so we submitted the amendment.
Wonderful, thank you. Delegate White.
Yes, thank you, Madam Chair. I wanted to know if this amendment is also reflected in the Senate bill that just passed regarding the mechanical devices.
It is not. We will have to amend the Senate
Yeah.
bill to match it when it crosses over, or it's already crossed over, but
Okay,
when we
thank you.
actually take that bill up.
Okay, thank you for the clarity.
But I would assume, may I, Madam Chair?
Yes,
Given that this is an amendment that is supported by both parties, according to the sponsor, it shouldn't be a problem.
okay.
Thank you, Madam
Any-
Chair.
No, this is the place. Any other concerns? All right,
Move the amendment.
is there, it's been moved and second by Delegate Taveras. Any concerns? All those in favor say aye.
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 Any opposition? Can you raise your little hand? Seeing none. On the bill as amended, may I have a motion, please?
Move the bill
Move
as
the bill.
amended.
Second.
It's been moved and second. Any discussion, Delegate Taveras? I see your hand up.
Is it possible to remember that if we want to join, I wanted to become a co-sponsor.
We're gonna
on-
get to that. We're gonna get to it after we take the vote.
Yeah, but for 111. Because I don't think we asked for that, because I would like to.
I can go back, but let me finish this bill first, okay?
Okay.
Just to keep it clear, I'm getting, at 5:35, I can't keep things too clear. So let me just do one thing at a time. And I thank you for being patient, okay? Let's finish this one. 172, all right? We moved the bill, we second the bill, we discussed the bill. There are no concerns. All those in favor say aye.
Aye.
Any opposition to this bill 172, please raise your little hand. I see none. It passes. Does anyone not want to be on that bill as a co-sponsor? Can you raise your hand on 172? I see Delegate Kaiser does not want to be on it. Anyone else? Okay, thank you. Let's go to 111. Does anyone not want to be a co-sponsor of that bill? Delegate Morgan doesn't want to be a co-sponsor, Delegate Hutchinson, Delegate Riley, and Delegate, I'm missing one hand, Chisholm. Okay, so
Right.
Morgan, Hutchinson,
Shalega.
Riley, Shalega, and Chisholm do not want to be on 111. The rest of us want to be on it. Thank you so much, okay? Let's go now to House Bill 333, and that is Hospital Financial Assistance Medical Bill Reimbursement Process. That is actually Aaron and Delegate Collison. Aaron.
This bill modifies requirements relating to a specified refund process for patients who paid for hospital services in calendar 2017 through 2021 and were eligible for free care. The bill alters the agencies with which the HSCRC must coordinate in the development of the refund process and the responsibilities of those agencies. It alters the refund process. It requires the Health Education Advocacy Unit in the Office of the Attorney General to assist patients in obtaining reimbursement. It requires hospitals to reimburse state agencies for costs incurred to implement the refund process. It authorizes tax information to be disclosed to a hospital, HSCRC, and other state agencies involved with implementation of the refund process, and it delays the due date for the 2024 HSCRC reporting requirements. There are amendments beginning on page 3 of your packet that were adopted in the Health Insurance and Pharmaceuticals Subcommittee. The amendments require the HSCRC, Department of Health, DHS, the Comptroller, MSDE, and each hospital to disclose to the HEAU relevant information necessary for the unit to assist patients in obtaining reimbursement under the bill on receipt of the patient's executed authorization for release of medical information. And it requires those entities to provide information to the unit within 10 business days of the request. The amendments also authorize the HSCRC to impose a fine not exceeding $50,000 per violation on hospitals who fail to provide the refunds as required by the bill.
Thank you. And that is Delegate Rosenberg.
Collison.
I'm
Madam
sorry.
Chair.
I'm
Madam
sorry,
Chair,
that
it's
is
me.
Collison. Collison. How did I make that mistake when you have been working on for years on that issue? And you're gonna take it to the House floor too. Go ahead.
You look alike,
Thank-
Madam Chair.
Absolutely
Chair.
not.
Right, it's been a long day. So this bill is the follow-up to a bill that we passed last year when there was a report that said that the hospitals had actually charged people who were eligible for free care. And we decided that there was agreement last year that there would be, that the hospitals would make it right. But we also said there may be some statutory language that would be required in the development of the plan on how the entities were going to, how the hospitals were going to reimburse the individuals who were overcharged. Therefore, this bill does that. It clarifies all of the pieces that are necessary in order to for the hospitals to proceed to refund the money to folks who qualified for free care when they receive the services. So with that, Madam Chair, I would move the amendments.
Is there a second?
Second.
It's been moved in second. Any discussion on these amendments? I'm gonna start first with Delegate Hill.
Thank you, Delegate Collison. The $50,000 per violation, where does that money go? Does it go to a fund? Does it go to the general fund? Does it go to the person who was violated?
Well, it doesn't go to the person who is violated. I believe it goes back into general funds. What would go back to the person who was violated is the amount that they, and that's not included in the 50,000, up to 50. And let's be really clear, it's up to 50,000, and that's a standard penalty amount throughout our healthcare code.
Okay, so, and then there's no mechanism if the person had to pay, and because of that, there's no civil option, or it doesn't, maybe this is really for Aaron, it doesn't preclude, you know, sort of like if I don't have my paycheck and it causes me to run over my bank account and now I'm in debt and I get kicked out of my apartment, right? So things have downstream benefits. This doesn't affect any potential recourse that someone may have, and none of the money can go to help people recover for having been overcharged and had paid money they were entitled to or not gotten money, right?
Thank you.
It's a separate course of action.
But I
Any
think
other-
the question is, is there an appeal process? There is an appeal process.
Yeah, and
built into
that's separate and apart from this
Right.
penalty on the hospitals.
Any other
Okay.
questions or concerns on the amendments that were moved? Okay. On the amendments, all those in favor say aye.
Aye.
Any opposition, can you raise your hand? I don't see any opposition. On the bill as amended, may I have a second?
Second.
They moved in second. Any discussion on the bill as amended? Seeing none, all those in favor say aye.
Aye.
Any opposition, can you raise your hand? Seeing none, it is unanimous. Does anyone not want to be on this bill? Please raise your hand. Delegate Chisholm, Delegate Shalega, Delegate Morgan, Delegate Riley, Delegate Hutchinson. Thank you for raising your hands. I appreciate it.
Madam Chair.
Delegate Kaiser, did you say something? Oh, no, she's on the bill. Okay,
Madam Chair?
yes, Delegate.
For Delegate, for Vice Chair Cullison, just apropos of my question, the last part of the amendment talks about a violation by the hospital being unfair, abusive, and deceptive trade practice and subject to enforcement and penalty provisions. So I don't know if it'll come on the floor, but because it's defined as that, it means that if our law allows for some kind of recompensation or something, that would still hold, I think. So I just saw that. I just thought you might.
Okay.
That's helpful. Thank you. Aaron, did you want to add anything? Okay.
No.
Okay.
Okay, thank you.
All right.
And thank you for the question.
Yes.
I don't
that's-
mind it. I actually welcome it. I just like to do it in order so that I can stay focused, okay? So thank you. I appreciate it. It makes things easier for the person who has the bill on the floor. So I really want to encourage you to ask the questions here and give suggestions, because and you'll find out after we're done today, a lot of you will get opportunities on the floor next week, okay? Next, I have House Bill 357, and that is Lisa and Collison. Lisa.
This bill alters the definition of purchaser for purposes of state law governing pharmacy benefits managers to include an insurer, nonprofit health service plan, or health maintenance organization, with a specified exception. As a result, the bill generally applies provisions of law governing PBMs to all entities providing prescription drug coverage or benefits in the state, including programs subject to the federal to ERISA. There are amendments on page 7 of the first packet of amendments that was sent out. Amendment number 1 is technical. Amendment number 2 retains the definitions of carrier and ERISA and retains current law for provisions of the bill flagged by MIA as potentially raising ERISA challenges.
Okay, thank you, Lisa. So this bill, this bill responds to the question that the independent pharmacists have raised for a number of years, when the Supreme Court passed a bill, and I think passed a ruled in 2019 that the states have the ability to regulate the activities of pharmacy benefit managers and in all plans in a state. Prior to that ruling, we did not have any jurisdiction over any of the PBMs that work with plans that are that fall under the ERISA or Employee Retirement Income Security Act. Those were all separate and only under federal authority. With this bill, it changes the ability, it changes what the PBMs who work with ERISA plans can do, and they will fall, their regulation will fall under the state now. And the distinction is it only applies to activities that are directly within the purview of the pharmacy benefit manager, not the plan from the carrier. So that, you know, there's a nuanced distinction, but there's a number of states that have passed similar kinds of rulings. Now, sky hasn't fallen yet. And we believe that this will help to make to sort of level that regulation playing field, so the PBMs have to follow the same rules no matter who when the customer comes into the pharmacy, no matter who they're covered by an ERISA plan or the commercial market. So with that, okay, and I see a question from Delegate Lewis. Madam Chair, may I?
Absolutely.
Okay.
Thank you, Madam Chair, Madam Vice Chair. I thank you for your work on this bill, Madam Vice Chair. I just want to make sure this is the bill where we promised the independent pharmacists that we would get them some level of relief. Is that right?
Yes.
And I'm assuming they're good with this, satisfied with some progress. Okay.
Yes.
Thank you. Thank you very much.
Okay, Delegate Hill.
Thank you. Before my question, can I move the amendments and then ask my question?
Okay, wonderful. Go
Second.
ahead. So the
Go for it.
amendments have been moved in second. So
All right,
now we
thank
are
you.
discussing. Thank you.
So-
Delegate Hill.
Thank you, Vice Chair Cullison. It's really a simple yes or no question. I love what this is doing. I just want to know, do we have any better way of distinguishing of what is a PDM plan and what is an insurance plan? Because they're always doing this. So it allows us to make this distinction, but can we actually make the distinction?
The ruling from the Supreme Court makes some distinctions, and essentially it's around what the reimbursement plans which are strictly owned by PBMs, because that's what they do. They negotiate the reimbursement plans. But it also, applies only to their activities. And they were very specific about that. Anytime you have anytime you have a plan, they're hiring the PBM to do all of the negotiations around the drugs. So where the issue will come is, things like pre-authorization, step therapy. Those are plans. Those are not PBMs. So that's, what I mean, but I think we're going to have to reevaluate it, or we may have to reevaluate it if there is any follow-up from this. But I will say that the MIA looked at this bill very closely. They did a report for us last year saying they felt that it was possible for us to do something in this area without being subject to litigation. So they feel fairly secure about it. And I know they did a lot of work on it.
Thank you. Yes.
I thought it was yes, no.
It gives me hope.
Okay, thank you.
Any other discussion on the amendments? Delegate White.
Yes, thank you, Madam Chair, and thank you, Vice Chair Cullison. My question relates to not just, really the amendments and where are the stakeholders on this, if there's any unreadiness, and if anything eases any additional concerns that were expressed by the opponents?
I have to be totally transparent and say no. The opponents are the folks who represent ERISA plans. And they're concerned that if the PBMs can't act in the same way that they've been acting, then they lose some leverage. But again, I think, first of all, the PBMs have proven themselves to be very agile and make adjustments very quickly. And they're competitive. It is a very competitive market, although there are only really 3 major PBMs throughout the country. I mean, there are more than that, but 3 that are major players, and they compete with each other for that market. So I think that they will probably survive.
Thank you. Thank you, Madam Vice Chair.
I just wanted to say the amendments are addressing MIA's concerns. So
Right.
Not necessarily the opposition, but MIA's.
Fair enough. Fair
Yeah.
enough. Thank you.
Thank you, Lisa.
I love the discussion. Delegate Lewis, your hand is still up. Delegate Robin Lewis.
Sorry, Madam Chair. I was just trying to get some steps in because I feel like I'm going to have
It's okay. Your hand is still up. Okay. All right. So I don't see any other hands up for discussion, and the amendments have been moved and second. All those in favor say aye.
Aye.
Any opposition to the amendments? Seeing none on the bill as amended, Delegate Collison, may I have a motion,
Move
please?
the bills amended.
Second.
It was moved in second. Any discussion on the bill as amended? Seeing
just-
none. Oh, okay, Delegate Taveras.
I just want to raise a concern that was raised during the bill hearing in subcommittee. There were folks from Jeff Guido and some of the unions that did raise some concerns. And I do think that while this is something that is needed, I do think that on a long version, we do need to address their concerns. I have some ideas, but I'll run them by Vice Chair Collison moving down. Thank you.
Thank you.
Thank you. All those in favor say aye.
Aye.
Any opposition to the bill? Can you raise your hand? I don't see any. Who does not want to be on this bill? Can you raise your hand? Oh, okay, everyone will be on the bill. Wonderful. So now we're going to go on to
Madam
House
Chair,
Bill. Yes,
I respectfully request to be excused from the remainder of voting this evening.
yes, your excuse.
Thank you.
And knock it out of the ballpark.
All right, thank you so much.
All right, bye-bye. Thank you for the courtesy. Now we have House Bill 382, and that is Lisa and Collison.
As amended, this emergency bill requires the Maryland Department of Health and the Prescription Drug Affordability Board to conduct a study on Medicaid reimbursement for prescription drugs and report back to specified committees on or before October 31st, 2023. Yeah, that pretty much explains what the amendment
All right,
Move the amendment.
the amendment has been moved.
Second.
All right, any discussion on the amendments? Seeing none, all those in favor say aye.
Aye.
Any opposition, raise your hand. Seeing none on the bill as
Move
amended.
the bills amended.
Second.
It's been moved in second. Any discussion on the bill as amended? All those in favor say aye.
Aye.
Any opposition, raise your hand. Who does not want to be on the bill, raise your hand. Everyone wants to be on it. Great. House Bill 418, Aaron.
This bill establishes the Behavioral Health Workforce Investment Fund to provide reimbursement for costs associated with educating, training, certifying, recruiting, placing, and retaining behavioral health professionals and paraprofessionals. The Maryland Healthcare Commission, in coordination with specified stakeholders, must conduct a comprehensive behavioral health workforce needs assessment that will recommend an initial allocation to the fund and identify the programs to be supported by the fund. There are amendments that were adopted in the Public Health and Minority Health Disparities Subcommittee that extend the submission date for the needs assessment to October 1st, 2024, and add the Maryland Department of Labor and the Career and Technical Education Committee to the stakeholders to be consulted with when conducting the needs assessment.
Bagnell.
Thank you, Madam Chair. We had a good discussion on this bill. The date change was requested by the MHCC. The other amendment conformed it to the Senate bill, which already moved third reader, and there was no opposition. Move the amendment.
Is there a second? It's been moved in second. Any discussion on the amendments? Delegate Johnson.
Thank you, Madam Chair. Just a quick question. In the hearing, it was the question asked, what are the funds for? Did we get that answered?
Delegate Bagnell or Aaron?
So the funds are essentially going to be defined by the needs assessment. This is actually modeled after other states that have created this fund, then done the needs assessment, and then had funding to actually do workforce development that's strategically aimed at the mental health workforce issues.
So it's going to go wherever the needs are?
Correct. You said that much more briefly than I did, but yes.
Thank you, Madam Chair. Thank you, Delegate.
My pleasure. Delegate Shalega.
Thank you. So, further question on the fiscal note, is it still the same? It's 500,000 this year and $1 million every year thereafter?
Aaron.
Yes, that's correct.
Thank you.
Any other questions? Okay. All those in favor of the amendment say aye.
Aye.
Any opposition? Raise your hand. Seeing none on the bill as amended.
Move the bills amended.
Second.
It's been moved and second. Any discussion? Okay. And I just want to say that we have a real workforce shortage, right? And this really will help. And this and a couple others, hopefully they will be able to pass. So thank you for your leadership, Delegate Bagnell, Aaron, and the committees. Really appreciate it. The bill has been moved in second. Any discussion? Any comments? Seeing none, all those in favor say aye.
Aye.
Any opposition? Okay, seeing none. Who does not want to be on the bill? Can you raise your hand? All right, everyone wants to be on the bill. Wonderful. House Bill 429.
Delegate, there are people
I
that
didn't
raise
get my
their
hand
hand.
up in time.
See, I am like moving along. Okay, that's okay. So
I'm for the bill. I don't want to be a co-sponsor. Thank you.
that's great. So Delegate
Same
Shalega
here.
and Delegate Riley do not want to be on the bill as co-sponsors.
Correct.
Thank you for straightening me out. All right, let's go actually to House Bill 429, Procurement Improvement Council membership. That is Lindsay and Delegate Care. Go ahead, Lindsay.
This bill, as originally introduced, adds the comptroller as a member of the Procurement Improvement Council and authorizes the comptroller to send a designee to the PIC if the comptroller is unable to attend. There are amendments that begin on page 12 in your packets that were considered in the Government Operations Subcommittee that add the Attorney General to the PIC and authorizes the Attorney General to send a designee if he's unable to attend a meeting, and then also adds to the PIC scope discussion of strategies to increase the participation of small minority-owned and women-owned businesses in procurement contracts.
Thank you, Lindsay, for your work. Delegate Rosenberg.
No, next one.
Oh, one second, Delegate Care. How
Care.
did I miss that?
Yes. This went through Government Operations Subcommittee with no controversy whatsoever, and I move the amendments.
All right. Is there a second?
Second.
It's been moved in second. Any discussion? All right. All those in favor say aye.
Aye.
All right. Any
The
opposition?
bill
Raise your
as
hand.
amended.
1 second. Any opposition to the amendment? Seeing none on the bill as amended. Go ahead, Delegate.
Move the bill as amended.
Second.
And it's been moved and second. Any discussion on the bill as amended? Seeing none, all those in favor say aye.
Aye.
Any opposition? Raise your hand, please. I don't see any. Okay, great. Who does not want to be on the bill? Can you please raise your hand? And I'm going to slow down. All right. See none. Great. We can move on to House Bill 454, Health Occupation Licenses, Certificates, and Registration, Immigrants. Lindsay and Rosenberg. Lindsay.
As originally introduced, this bill prohibits a health occupations board from denying a license, certification, or registration to an immigrant if the individual meets the relevant educational training or professional requirements for the profession. And also authorizes the use of an individual taxpayer identification number for licensing purposes and makes other related changes. The amendments that begin on page 16 in your packet were considered in Health Occupation Subcommittee. Prohibit a health occupations board from requiring that an applicant provide proof that the applicant is legally present in the United States or have a social security number or individual taxpayer identification number as a condition for licensure, certification, or registration, and authorizes a board to require applicants to provide alternative documentation in an application file as authorized under federal law.
Okay, Rosenberg.
Well,
Actually, go ahead.
Well, I will be brief because I think I would defer, perhaps that's
I know.
what you were about to do, to Delegate Lopez,
Yeah,
both the sponsor of the bill and will be the floor leader. This bill is consistent with the laws of 20 states, including Florida and Texas, and is also consistent with federal law. And so I would defer to Delegate Lopez for any further questions.
thank you, Delegate Lopez.
Thank you.
You're welcome.
Sure. I guess probably the quickest way to describe this bill is it allows for the licensing application process to occur concurrently with
Actually, if I may, Delegate Lopez, so that you don't have to repeat yourself twice, may we move the amendments and then have the discussion? Okay, can someone move the amendments?
Move the amendments.
Okay, okay, any discussion? Go ahead, Delegate.
Sure. So to summarize what this bill does, it allows someone to apply for their healthcare occupational license at the same time as they're working to get all of their immigration paperwork aligned. And that is important because obviously we have this huge shortage of healthcare occupations, nurses at the top of that list. And because we're behind other states are doing this in a more expeditious fashion, and they're beating us in terms of recruitment.
Okay, thank you. Any other discussion or concerns? I'm going to go to Delegate Shalega, followed by Delegate Kenker.
Thank you. So it looks like in the amendments, the people we're talking about are lawfully present here. Is that correct?
Yes, I mean, you have to have an I-10, right?
And I think, yeah, doesn't the bill say lawfully present? Okay, thank you.
Yeah, Delegate Kerr.
Thank you, Madam Chair. I just wanted to point out that both HB 418 and this bill came out as recommendations on the Commission to study the critical workforce shortage in healthcare on their work that we did over the summer. Both of these were recommendations of that commission.
Okay.
Thank you.
Thank you. Any other concerns, discussions? This is the place to have it. Suggestions after we take the vote. All right. Seeing none on the amendments, they've been moved and second. All those in favor say aye.
Aye.
Any oppositions to the amendment? Seeing none on the bill as amended. Okay, it's been moved and second. Is there discussion on the bill? Seeing none, all those in favor say aye.
Aye.
Any opposition, please raise your little hand. Okay, I don't see any opposition on it. Okay. Who does not want to be on the bill? Delegate Shalega, Delegate Brian Chisholm, Delegate Morgan, Delegate Riley. Thank you. Thank you so much for the discussion. Really appreciate it. Now we have House Bill 477.
This bill, HGO, is a secondary committee. There are amendments on the bill that are in page 21 of your packet that were adopted in the Appropriations Committee. The bill requires each public senior higher education institution in consultation with students to develop and implement a reproductive health service plan to provide at the institution or to refer students to a comprehensive range of reproductive health services. The amendments alter the definition of public senior higher education institution to exclude certain institutions that do not have residential campuses and strikes the requirement that the plan include access to transportation to support students in accessing off-campus services.
Actually, this is Bagnell.
Well, yeah.
Oh,
It didn't
but
go to
actually,
subcommittee.
Aaron,
Yeah,
it
it did
didn't
not
go to
go to-
subcommittee.
It didn't go to subcommittee because HGO is the secondary committee, and these are the amendments that were approved by the primary committee, which is appropriations.
Okay, so why don't we do the following? Let's move the amendments and then have a discussion. Is there a motion in the amendments?
Move the
Yeah.
amendment.
Second.
It's been moved in second. Let's open it up for discussion. Any questions or discussion on this bill? Can you be so kind and raise your hand? I have Delegate Shalega.
Thank you. So I read the bill. I just saw, the page 21. It was on a separate email, so I'm sorry. Can we offer amendments to this as the secondary?
Aaron,
I think if you wanted to, the course of action would be to hold it and bring it up again at the next voting session.
Okay, because I would like to offer some amendments to it.
we can actually hold it. We'll probably be voting more than once next week. So we probably will be voting probably Tuesday, Wednesday, Thursday. So if I can ask you, Delegate Shalega, I'll grant you the whole, but can you do me a favor and try to get those amendments drafted as soon as possible?
Yes, I will do that. Thank you.
Thank you. I appreciate it. Thank you so much. Because appropriation has been great to us. So I want to continue that. Thank you.
Who do I talk to about amendments?
You can talk to me or the amendment office or.
Okay, I'll come
send
see
them to me.
you. I'll come see you. Thanks.
Okay, Delegate
You
Bagnell.
must go to Chestertown.
Thank you, Madam Chair. Just a procedural question. If we offer amendments as the second, does that then go back to the other committee for consideration?
Yes, so you don't, it's kind of a back and forth.
Okay, got it. Thank you.
Mhm.
Okay. Any other, we did move the amendments. We were discussing it. Any other questions? We're gonna hold the bill. Delegate Taveras, did you have a question?
No, I'm just trying, I was just confused. What do you mean? Where do we go back and from, like, back and,
So if this committee would offer amendments, appropriations would then have to see the HGO amendments and vote whether they agreed with the HGO amendments.
would it not be just simpler if the amendments were provided on the floor?
Yes,
Can we not do that?
but it's the delegates right anyone to raise amendment on, to bring it. So it is a process. So I'm going to allow it. Okay? Because this is where we discuss it. Okay?
Yes.
Thank you. Delegate Hill and then Rosenberg.
I was just wondering, you may were going to do it. Are we going to go ahead and discuss the amendments that were already there and at least vote those in and then come back with Delegate Shalega's amendment when we revisit it, or we're going to hold the whole thing and not have any discussion and move the amendments and vote the ones we have up or down?
I think, Aaron, what's your preference? Because then we'll start all over again. We may have to start the discussion all over again.
Yeah, maybe treat it like you would hold any other bill and just have the
Yeah.
discussion.
Then,
And Delegate Shalega can offer her amendment to the full committee at the next voting session.
and the only reason why I asked is because I don't want to make things difficult for her, but it is really on me. So I apologize to Aaron. I'm going to hold it and we're going to have the discussion when we come back. Okay? Delegate Rosenberg.
Am I correct, Aaron, if an amendment is offered in the secondary committee and it fails, the bill then moves to the floor?
Correct.
That amendment does not have to
Yeah,
be
it's fine.
considered.
If HGO does not change the bill, then appropriations does not need to revisit the bill.
Thank you.
All right, great. So we're gonna hold that bill, okay? We're going to go on to House Bill 504, Aaron and Bagnell. Aaron.
This bill codifies the Maryland Developmental Disabilities Council as an independent unit of state government. There were no amendments.
Move the bill.
Second. I wasn't sure if you wanted me to speak or not. Yeah, there was no opposition, so. You're muted.
All those in favor say aye.
Aye.
Any opposition? Raise your little hand. All right, great. Oh, it's unanimous. Well, we can't accept co-sponsorship, so sorry about that. House Bill 507, Lindsay.
As introduced, this bill would have established a licensing and regulatory scheme for graduate registered physicians under the State Board of Physicians. The amendments that begin on page 23 of your packet and they go between two packets strike the bill and instead authorizes a supervised medical graduate to perform delegated duties under direct supervision of a delegating physician in accordance with regulations adopted by the Board of Physicians and make the bill an emergency bill. These were considered in the Health Occupation Subcommittee.
And as amended, it was agreed, these are amendments that the parties came to, and it was unanimous in the subcommittee. So move the amendments.
Is there a second? All right, any discussion on the amendments that were just moved? All right, seeing none, all those in favor say aye.
Aye.
Any opposition, raise your little hand. All right, seeing none on the bill as amended.
Move the bill as amended.
Second.
It's moved and second, any discussion? Seeing none, all those in favor say aye.
Aye.
Any opposition to the bill as amended? Who does not want to be on the bill? Can you raise your hand, please? Everyone wants to be on it. Thank you. All right, we are now on House Bill 571, and that is Lisa and Collison.
So this bill requires the Maryland Department of Health to allow specified entities to choose the formulation or dosage of an opioid overdose reversal drug approved by the FDA that the entity is provided with through the Overdose Response Program. There are amendments on page 49. Amendment number 1 is technical. Amendment number 2 authorizes the Attorney General to direct the Opioid Restitution Fund Advisory Council to form subcommittees to conduct business related to the purpose of a court or administrative order or settlement agreement, authorizes the state to receive funds from opioid-related court or administrative judgments or settlement agreements, and authorizes the Secretary of Health to establish and administer a grant program to distribute the funds in accordance with the judgment or agreement, and it changes the enactment date.
Thank you, Allison.
That's me.
Yes.
Thank you, Lisa. So this began as a very simple bill.
Ah.
And it was, and the Attorney General realized that there was an opportunity here to make sure that his office would have a role in the restitution funds and make sure that there was adequate statutory coverage and authority for him to bring cases when there are issues around the restitution fund. So it was voted unanimously in the subcommittee. So I would move the amendments.
Second.
It's been moved in second. Any discussion on the amendments? Seeing none, all those in favor say aye.
Aye.
Any opposition, raise the little hand, please. All right,
Move
seeing
the bill
none.
as amended.
Second.
It's been moved in second. Any discussion on the bill as amended? All those in favor say aye.
Aye.
Any opposition? Seeing none, it's unanimous. Does anyone not want to be on the bill as a co-sponsor? Can you please raise your hand? Delegate Riley. All right, thank you. Now we have House Bill 586, Lindsay and Kerr.
As introduced, this bill requires state agencies that purchase compost mulch or other soil amendments to give preference to products produced from municipal solid waste, food waste, sludge, yard waste, clean food waste, or other organic materials under specified conditions, and defined preference. The amendments that begin on page 54 of your packet were generally considered in the Government Operations Subcommittee. The amendments exclude sludge and add dredged material and construction waste to the list of materials from which the compost, mulch, or soil amendments may be made. Adds aggregates to the bill. That was something that was in the Senate crossfile, but the bills came in different. Adds a requirement that the product be readily available and requires the Maryland Green Purchasing Committee to establish specifications for compost, mulch, or other soil amendments or aggregates to be used by units and procurements in lieu of establishing a price preference. The reason I say these were generally considered in the Government Operations Subcommittee is for the benefit of those members. After the subcommittee met on these amendments, I realized I had not struck the definition of preference from the bill, even though we were changing the price preference to the specifications being created by the Maryland Green Purchasing Committee. So the amendment is slightly different in that it strikes that definition of preference and updates the purpose paragraph.
Thank you, Lindsay. Delegate Kerr.
Delegate Chisholm wanted to make sure that this was not going to include any composted bodies. Other than that, it was unanimous in subcommittee, and I moved the amendments.
I'm good with the bodies.
Second. It's been moved and second. Any discussion? Seeing none, all those in favor of the amendment say aye.
Aye.
Aye. Any opposition? Seeing none, on the bill as amended.
Move the bill as amended.
Second.
It's been moved and second. Any discussion? All those in favor say aye.
Aye.
Aye. Any opposition? Who does not want to be on the bill? Can you please, as a sponsor, raise your hand? Delegate Shalega. Delegate Riley.
Madam Chair,
Okay.
I said Chisholm. I actually meant Morgan.
Okay, so is this just 1 second? So I got two, Delegate Shalega and Riley do not want to be on the bill as co-sponsors. Okay, let's move on to House Bill 588. That is Lisa and Delegate Collison.
This bill requires the Maryland Health Benefit Exchange to establish a qualified resident enrollment program to provide qualified residents with access to health, vision, and dental coverage through the exchange. The exchange, in consultation with the insurance commissioner and as approved by the exchange board, must submit a federal state innovation waiver amendment application by July 1st, 2024 to seek federal pass-through funding. If the waiver is approved and there are available funds, the exchange is required to establish subsidies under the program. By January 1st, 2025, the exchange must adopt regulations to carry out the program. There are amendments on page 56. Amendment number 1 is technical. Amendment number 2 requires that in addition to health insurance coverage, the program will provide qualified residents with access on the exchange to dental and vision plans, and authorizes the exchange to use federal pass-through funds for programs as approved by the federal government under an amendment to the state's 1332 waiver. Amendment number 3 requires the exchange to submit a plan for implementing subsidies to the General Assembly within 6 months before the fiscal year in which the subsidies will be implemented.
Delegate Collison.
Okay, so this is the bill that, as Lisa just said, we need to request a waiver from the federal government to include what we are describing as qualified and eligible residents to participate in our healthcare exchange or health benefit exchange. You'll recall that folks who are not documented at this point can not participate in the exchange itself. They can buy private insurance, but as you know, our exchange has some of the lowest cost programs in the country, not just the state, but in the country. And so having access there will be very beneficial to this population. And the amendment is designed to make sure that if we are approved by the federal government, that we can have a subsidy program for some folks who might qualify, who might be income eligible, but that program would not be allowed to proceed without the action of the General Assembly. The plan for implementing a subsidy program would come back to the General Assembly. So that was the safeguard around making sure that the funds that the exchange would be using would be ones that would not impair other opportunities on the exchange. So that's what the amendments are intended to do. And with that, I will move the amendments.
Is there a second?
Second.
It's been moved in second. Any discussion on the amendments? Seeing none on the amendments, all those in favor say aye.
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 Any opposition to the amendments? Seeing none on the bill as amended, may I have a
Move the
motion,
bills
please?
amended.
Second.
It's been moved in second. I open it up for discussion now. Any discussion on the bill as amended? All those in favor say aye.
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 Any opposition, please raise your hand. I have Delegate Brian Chisholm, Shalega, Riley, Morgan. Thank you. Who does not want to be on the bill? As a co-sponsor, will you raise your hand, please? Shalega, Riley, Chisholm, Morgan. Thank you. And thank you for your work on that bill. Now we are going to move on to House Bill 605, Commission to Establish a Memorial to the Global War on Terror. And that's Lindsay and Delegate Kerr.
This bill establishes a commission to establish a memorial to the global war on terror. The commission must provide recommendations for the funding, design, construction, and placement of an appropriate memorial dedicated to Marylanders who fought in the global war on terror and their families. The Maryland Department of Veterans Affairs must provide staff for the commission. The dates in this bill and the effective date on the bill are tied to the commission to establish a Maryland Women Veterans Memorial, which is also staffed by the Department of Veterans Affairs. So to accommodate that, this bill doesn't take effect until the other commission's work is done. Assuming that commission terminates as expected, this commission would be required to submit a preliminary report by February 1st, 2025, and a final report October 1st, 2025. And there are no amendments. This was considered in Government Operations Subcommittee.
Move the bill.
Second.
All right, it's been moved and second. Any discussion on the bill? All those in favor say aye.
Aye.
Any opposition? All right, the bill passes unanimous. House Bill 626, Animal Testing and Research, Human Relevant Research Funding and Animal Testing and Research Licensure. This is Aaron and Bagnell.
This bill requires certain research entities to provide certain contributions to the Maryland Department of Health and establishes the Human Relevant Research Fund in the Maryland Technology Development Corporation to promote state-funded research intended to develop human relevant alternatives to using non-human animals in testing and research through grants and loans. TEDCO is also required to establish a specified grant and loan program. The amendments that were offered in the Public Health and Minority Health Disparities Subcommittee strike the prohibition on using non-human animals to conduct research in the state unless licensed by the Secretary of Health, and instead requires each research entity to provide a contribution, certain research entities to provide a contribution to MDH based on the number of animals on which the entity performs research. It strikes the requirement for the Institutional Review Board approval to receive a grant or loan and provides that a research entity that does not pay the contribution required under this bill may be subject to a specified civil fine.
Okay.
Thank you, Madam Chair. So this is a really elegant solution to dealing with technology and advanced technology. And I think it just took us a little time to sort of wrap our heads around it because of the title. Essentially, industry's moving away from animal testing. We had that bill last year. This bill creates a contribution fund for the people utilizing animal testing to be able to pursue technology and move away from animal testing.
Okay, are there?
And move the amendments.
All right, so may I get a second, please?
Second.
Second.
Now let's open it up for discussion. Delegate Shalega, followed by Alston, followed by Chisholm.
So if I'm understanding this, you're gonna charge a fee to researchers who use animals. Where is the fee going and what are you doing with it?
So the fee is actually, the researchers want to do the contributions because it's creating a fund so that they can fund other technologies that don't use animals.
So how much is it and where's it going?
It's spelled out in the bill. It depends on how many animals they're using. So the contribution is tied to the number of animals that they're using in career testing.
Well, give us a number. Is it $10, a cent, a dime? Is it,
Oh, no, I've got it. I've got it up on my screen. It's sorry, I didn't have my folder open.
It's all right, relax. It's
Take
okay.
your time, Heather.
Yeah, because it could be stressful and we appreciate the
Yes, it can be.
time.
All right,
They
so
got changed.
as amended, it is on page 7, $5,000 for up to 100 animals, $10,000 for more than 100 but not more than 500 animals, $55,000 for more than 500 but not more than 5,000 animals, $75,000 for more than 5,000 animals. And so it's spelled out and it's tied to the number of animals that are being utilized in testing.
So where's the fee going and what are they going to do with it?
It's going into a dedicated fund for utilizing human relevant technology that doesn't use animal testing.
So who gets that money? I mean, we're transferring money from Hopkins, basically what we're doing, because they do a lot of medical research there using mice, using sheep, using other animals. So it's a transfer of money from Johns Hopkins, probably Maryland. Delegate Hill can tell us more, I'm sure. And then you're putting it in a fund, and then who gets the money?
It's the Maryland Technology Development Corporation.
But who do they give it to?
For distributing the funds.
To who are they going to give the money to?
So people would do research. They would present to the board research proposals, and then they would make the rank, and they would rank the proposals, and then based on their rankings would make recommendations for the reward. It's modeled after the Stem Cell Commission, how they provide grants and loans.
Okay. All right. This is going to make medical research more expensive. Thank you.
Okay. If I may, the medical research facilities, Hopkins and others, they came to see me and they agree with the bill because eventually they would like to move away from, animal testing. So they agree with it and they compromise. I just for disclosure as well, because they asked for a meeting and I thought, oh, they're going to come and oppose it. And then they came and said, oh, we are, we want to support it and we're working with a drafter. So just for the record, Delegate Chisholm, followed by Hill, followed by Riley, followed by Johnson, and then Collison. I love the little hands. It makes it very easy.
So I guess I'm a little confused just looking at the fiscal note because it's got $3 million in revenue from state revenue. Then it's got $3 million coming out of expenditures in the general fund, and then another $3 million in the state fund. So, or special funds, but it's still a net of negative $3 million to the general fund. I'm lost on who's getting the money, what we're paying out, because based on, I guess, simple math back of the napkin, we're paying out $6 million, but bringing $3 million in. And with the amendments, is that correct?
So it's just showing whatever goes into the special fund. it's a zero-sum game in terms of, it's an estimate. If you read the fiscal note, they're estimating that it'll get $3 million, but it's hard to, it was hard for them to determine hard numbers. My cat really wants you to pass this.
I noticed that.
She did not come over till this one.
You did that on purpose.
She's a player. So yeah, and we ran it by appropriations. But the fiscal note, the way I read it was, it's just showing that what would estimated to be going to a special fund.
Okay.
Be paid out of the special fund. It doesn't affect general funds.
Okay. All right.
And Delegate Chisholm, Hamilton came over to say, hey, look at me right here.
He
I'm
cares
Hamilton.
He cares.
Who do I have? Who do you have there? Is that Hamilton? I can't see well.
This is Belle.
Oh,
Ooh,
Belle.
really
Yeah,
nice.
Belle. There you go.
And Hamilton's back there.
She also has Hamilton back there. Any other questions, Delegate Chisholm?
Oh, that's good. Thank you.
Okay, thank you. Delegate Hill.
Thank you. So I was looking at the TEDCO letter, and of course Hopkins gave oral, no written letter. And I think some of this answers Delegate Chisholm's question, because TEDCO said the estimated will cost $440,000 annually, or $2,200,000 over 5 years. So that seems to be where some of the money's going, and the rest of it goes to these research grants. I guess the question I had, so Hopkins and Maryland and other research institutions are contributing. Do they also, because I understand they also have research going on at those institutions at non-animal models as well. So when I spoke to one of the advocates, and I just wanted to be clear, so if they have a researcher at Hopkins or whatever who has a project, and I think Hopkins said that they have an overload of, they have more projects than they're able to fund, because they do fund some stuff, and of course they get NIH grants and all kinds of other stuff. But a researcher at Hopkins who can also apply for these grants, as long as what they're doing is non-animal testing models. Is that right? So there's no prohibition on Hopkins getting some of this money back for research they're doing specific to this area.
Yes.
Okay, any other questions, Delegate Hill? Okay, Delegate Riley, followed by Johnson.
Thank you, Madam Chair.
You're welcome.
So, okay, so I see. So basically, we just changed the word fee to contribution. So the original bill had those numbers in there. So we just changed the words. And you're saying that they agree with it. I heard that. So that takes the opposition away from the Johns Hopkins, but of course they do have a lot of money. They were very concerned, because they absolutely said that there's a lot of disease that we cannot currently find cures without using animals. Okay. So this could be a very long term, not short term, possibly. And then also during the hearing, so I understand, we got Hopkins approval, what have you, because they have funds and they want to be able to put in there now that they can access the grants. That's good. But during the hearing, the bill is it doesn't really mention other products, but during the hearing, I did ask the question, this is not only for medical research, this is for every type of research that uses animals. So I most likely will still be voting no, because I know there's a lot of companies, because when this bill came out last year, there were several companies that use animals as well, and said it would be very difficult to, transfer, what have you, or to change that policy for a lot of products that we use. So I just found it interesting how this bill didn't really put those other products in there. But just to clarify, other products are included in this bill, correct? Is that money going, is that money going to the same account for, say, I don't know, a cosmetic company? Is this follow the same guidelines?
To address this one, Aaron or Terry Hill or Bagnall?
Delegate Cullison might, but yeah.
Allison, okay.
All
right.
Right. So I if the cosmetic companies are doing research, so if they are doing research on animals, then they would be eligible to apply for the grants if they decided not to do their research on animals. And so just want to be clear that, we do acknowledge that at some point you may need some sort of living creature to continue work. And this wouldn't probably eliminate it 100%. But we've learned over recent years that with the technology that we have, we can use a lot less animal testing and get better results because we can actually use human cells, which are harvested from cadavers and from people who have had surgery. They would sign a release saying, you can use the tissue for research purposes. With the computer modeling that we have now, it's much more realistic than realistic than some animal testing is, because mice are not human, and humans are not always going to respond in the same way that mice do. So it's about the whole bill is about trying to reduce the amount of animals that are used in research. And as we've said, the research institutions are on board.
Okay. Madam Chair, can I have a follow-up?
Sure. I mean, I'll ask all the questions you want. This is the place right here.
Okay, so, during the hearings, I hear what you're saying that, once they came back, they were fine. But I think because they're, forced to do something going forward, otherwise you would have completely banned them. But, from the testimony I heard, they were extremely concerned because they are nowhere close to just doing it strictly without using animals.
Any animals,
So,
right.
So then in the grants, knowing that it could be a long time. So in the grants, all this money is going into this fund. So are the grants going to be accessible if they start reducing the number of animals in testing, or do they have to completely ban using the animals and then they apply for the grant?
May I, Madam Chair?
Yes.
No, if they don't have to ban, if they're still needing the animals for a particular thing, they will do that. But if they want to do some additional research in another area or on another, in another area, then they would be able to apply for the grants. So it's not about eliminating, it's about encouraging them to use more of these, innovative technologies to do the research. But we, as I said, we recognize that unfortunately there are going to be periods where they need the animals.
Okay, so just to clarify that, so if they're still working on projects, a certain virus or something, and they're using animals, that's okay. But if they start researching something else by using other items that, we want them to eventually get to, then they can apply for the grant and get monies.
Yes.
Okay, thank you. Thank you, Madam Chair.
Okay, thank you for your questions. Delegate Rosenberg, followed by Delegate Hill.
I would just reiterate what Delegate Cullison just said, that this is a fund that creates an incentive for research that does not use animals, because we would be stating as policy that we are encouraging that use, but no one is required to use it. No one is prohibited from use this. No one's required to use this fund, and no one is prohibited from using animals in their research. Thank you.
Thank you. Delegate Hill.
Thank you. So this is the first time I'm seeing the amendments, but I just wanted to make sure I'm clear. First, I think for the record, Hopkins did not come in opposed. They came in, at least they're listed as favorable with an amendment. The second thing is, my understanding is that the bill, unlike the legislation we passed, I think that I introduced a year or two ago, that Delegate Riley, I believe you're referencing, that had to do with cosmetic testing. In that case, we banned the sale of cosmetics that were tested on animals and the use. This does not ban animal testing. It actually creates a fund to incentivize research into alternatives. So not just research that doesn't use animals. I don't think the fund does that unless the amendments change it. The fund is for people who are researching alternative models so that we can accelerate finding these non-animal models that will eventually be the kind that Hopkins or any other, the cosmetic people, whoever, will be able to say, I've got a great model because you're correct. The non-animal models are good. In some cases, they're better than animal models, but we don't have non-medical models to substitute for every type of research that we do on using animals. So I thought the fund was to accelerate the research to find these better non-animal models. And it doesn't ban anybody from using animal models, but it's trying to help them find an alternative sooner. Am I wrong about my understanding?
That's correct. That's correct. And the amendments took it from a licensure process to a contribution, which is less administratively burdensome.
And so even a small, again, on the amendments, would a small researcher, not a multi-billion-dollar, but a, $500 million researcher who's using animals be required to pay something into the fund because they're using animals?
Sorry, go ahead. Aaron,
who has to contribute to the fund? Anybody who's using animals in any kind of research, or only large research projects that are using animals?
It would be anyone who submits an animal, plant, and health, animal and plant health inspection service form 723.
Okay.
And then the amount is based on the number of animals that they report on that form.
Very good. So that's basically anybody who we in the state approve to use animals, if they're doing it legitimately, they file that form, they get approval to do their research with whatever oversight we require to make sure the animals are fairly treated, et cetera, and they then have a fee, sort of like, I don't know, physicians get fees to help support nurses and other scholarship programs. So it's the same idea. Okay, thank you.
All right, we're going to go to Delegate Bandari, followed by Shalega.
Yeah, thank you, Madam Chair. I really love this bill. Number one is like animal testing is very cruel and inhuman. Second is animal testing is not always reliable. And an alternative testing method exists. The reason I like this bill is there are so many alternative testing methods available that do not involve animals, such as computer simulation, cell culture, and human volunteers. And those methods are often more reliable, cost effective, and ethical. Hopefully, after this bill, we could have more bills than could help animal, because animal testing is not always necessary, and animal testing is very, very expensive as well. Thank you.
Delegate Shalega.
So I'm reading that there's a $1,000 a day civil penalty that's going to be enacted upon anyone who fails to pay the contribution. Seems a little heavy-handed, but I was also wondering, I mean, don't you want them to report back to you? You really kind of have, I'm guessing, really little idea of how much money is this going to generate, and you're creating a brand new program. So I'm wondering if you want to report.
There's a reporting requirement.
There is one?
Yes.
I don't see it.
In the TEDCO part,
Okay.
page 6 of the bill, line 5, they report on the description of the research performed.
Okay.
By the recipient of the grants. And
All
they
right,
get that
thank you.
every year.
Delegate Bandari, you still have a question?
No, I'm sorry.
Okay. All right. Are there any other questions or concerns regarding this bill? The discussion has been rich and very good. Any other concerns? Okay. Did we move the?
Are we on the amendments?
Yeah, did we move the amendment? Let's just, for the record, because I don't
We
remember
move the
anymore.
amendments.
All right, we
Second.
moved in second. Any discussion, any further discussion? Although
No.
all those in favor say aye.
Aye.
Any opposition, raise your little hand.
Move the bill.
Seeing none. Oh, wait a minute, there's opposition to the amendments. No? Okay, great. The amendments passed. It was unanimous on the bill as amended. All those in favor.
I think Delegate Riley raised her hand.
No, but I
Oh,
think she said
didn't.
it was a
Yeah,
mistake.
that was on, thought we were on the bill.
Right.
Thank you.
Sorry.
Move
So
the bill as amended.
I'm sorry.
it's okay. It's all right. It helps me stay straight. I'd rather you check me than make a mistake. So the bill has been moved. Let's get a second.
Second.
It's been moved in second. Any discussion on the bill as amended? Seeing none, all those in favor say aye.
Aye.
Any opposition to the bill, can you raise your little hand? I have Delegate, and I don't mean that your hand is small. Delegate Shalega, followed by Morgan, followed by Chisholm, followed by Riley. Thank you very much for a wonderful discussion and for your contributions. Now we're going to go to the next bill, which is House Bill 636. And that is Public Information Act, inspection of email addresses and telephone numbers. And that is Lindsay and Delegate Kerr.
This
Delegate
bill-
Shalega and Morgan, your hands are up. You have that's from the last in? Okay, thank you. Go ahead.
This bill alters the definition of personal information under the Maryland Public Information Act to include an individual's email address. The bill also makes other changes under the PIA that establish when a custodian is prohibited from allowing or authorized to allow the inspection of records related to email addresses and telephone numbers as specified. There are no amendments, and this bill was considered in the Government Operations Subcommittee.
Delegate Kerr.
Yes, Lindsay, can you remind me of the vote? I think there was some opposition.
I have that it was unanimous. I think there was
Even
some
better.
discussion, but that everyone was okay at
Yeah,
the
I
end.
remember there was some discussion. So, yes, we did have a robust discussion in subcommittee, and I moved the amendments.
Okay, wonderful.
No amendments, just
No amendments, it's just favorable. Move the bill. Move the bill, Delegate Kerr.
I moved the bill, Madam Chair.
Is there a
Second.
second? It's been moved in second. Now we're all tired. Moved and second on a favorable bill. All those in favor say aye.
Aye.
Any opposition on this bill? Raise your hand. I see none. Thank you. Let's move
No,
on. to-
wait. I
Oh.
I was the one who had raised. Yeah, I was the one who had raised the concerns about the Public Information Act to include emails. This was just for schools and children. But if it's, it was clarified, so that's why I said it was okay.
So Delegate Taveras, what I had said earlier when I was not muted is that I need you to bring and this is for all of us, I don't know we're tired, bring the concern like when we're early in the discussion, because it's hard after the vote. So tell me I know we just voted on the bill. Do you want to vote against it? Because we took a vote on the bill.
No,
You can
I-
ask the question, is there a concern?
I'll be honest, I'm too exhausted to think it through right now, but I voted it out of committee, and I think
But let's go through, I know we just voted the bill, right? But for your benefit, just to make sure, because we want to vote on things we know what we're voting on. I would like, Lindsay, can you tell us what the bill does again?
Sure. So the bill is altering the definition of personal information under the Public Information Act, and then it's clarifying when a custodian can or cannot release somebody's email address. Basically, the Public Information Act hadn't previously thought a lot about email addresses in regards to someone's information. During the subcommittee discussions, as I recall it, Delegate Taveras raised some questions about police accessing the contents of someone's email as part of an investigation. So just to clarify, this bill doesn't impact evidentiary procedures in criminal proceedings. If someone has committed a crime and you're trying to get at the content of their emails, that's different. That's criminal law, criminal procedure stuff. This is the Public Information Act. So someone in the public is trying to get your information for some reason. Sometimes they can get at your information. And so covered in this bill is, for instance, if you have a license, your business email address can be included in the information along with your business address and your name. But with regard to students, a student's personal email address cannot be acquired by a member of the public. And the personal email address is distinguished from sometimes students are issued school email addresses, and those would not be covered.
Okay.
So hopefully that clarifies it for people.
Does
It
it
does.
clarify it for you, Delegate Taveras?
It does. I mean, it has to be in a public information realm for it to undergo a Public Information Act.
Yeah, it doesn't
No.
apply for the schools, Lindsay said, and that was your concern, and the
Yes.
police as well. And she says it does not in those hearings. Any other questions you may have about that?
Not at this time, no.
Okay, Delegate Riley.
Thank you, Madam Chair. Yes, I've had on my notes that, not in that subcommittee, but that Delegate Kipke had some questions on the floor during the hearing, and then he had some follow-up questions as well. Were those amendments, were they addressed? Are these his suggestions, or did he get his questions answered? Do you know?
I can't speak to that. I didn't take
Okay.
part in any outside discussions with him and the
Are you
advocate.
sure that it is this bill?
Yes.
Okay,
Okay, all right.
all right.
Okay, I can, follow up with him later, and but I'm good for now. Thank you.
Okay, so any other questions or concern on this bill? All right, so the bill was moved in second. All those in favor say aye.
Aye.
Any opposition? Seeing none, the bill passes. And thank you, Lindsay, for addressing the question. And Delegate Taveras, thank you for asking it, okay, and stopping us. But let's try to do it at the beginning of the discussion, okay? So now we have, one second, let me get myself, House Bill 693, State Board of Pharmacy Board Membership and Delegated Pharmacy Acts, and that is Lindsay and Rosenberg.
As introduced, this bill adds a registered pharmacy technician member to the State Board of Pharmacy, specifies that a licensed pharmacist may delegate pharmacy acts to be performed at a remote location to a registered pharmacy technician or registered pharmacy intern as specified, prohibits a registered pharmacy technician or pharmacy technician trainee from making decisions that require the professional judgment of a pharmacist, repeals the prohibition on a registered pharmacy technician administering flu vaccines, and prohibits a pharmacy technician trainee from administering vaccinations. The bill also extends the termination date for the board by 10 years to July 1st, 2033, subject to evaluation and reestablishment provisions of the Maryland Program Evaluation Act. There are amendments on page 61 of your packet that were adopted in the Health Occupation Subcommittee that make the bill an emergency bill, specifies that a licensed pharmacist may only delegate the entry of certain data into databases or patient charts to be performed at a remote location and not other delegated pharmacy acts, specifies that a delegated pharmacy act includes administration of an influenza vaccine only to an individual over the age of 18 years, and prohibits a registered pharmacy technician from administering any vaccine to an individual under the age of 18 years. After the subcommittee met on this, the Board of Pharmacy did raise a clarification. So Delegate Kipke and I worked with the board to clarify the amendment to make a technical change, just to clarify that pharmacy techs can administer a flu vaccine to adults, no other vaccines, just the flu vaccine. They wanted to make clear when we said the flu vaccine that we addressed no other vaccines. So that is in the version of the amendment that you're looking at now. That was clarified after the Health Occupation Subcommittee voted on this, but the intent is still the same as that discussion. And the sponsor and the board were both comfortable with that updated amendment.
Delegate Rosenberg.
Thank you, Madam Chair. You may recall from the bill hearing that the sponsor, Delegate Kipke, discussed some of these compromises, specifically the under 18 language, that prohibition on the technicians. And so this is a bill that passed the subcommittee unanimously. And I would, if there are no questions, move the amendments.
All right.
Including, the amendments include the change, correct? The amendments
Yes, they do.
before us.
That's what you have in your packet now.
So there's just one vote needed.
Okay,
All
I just
right.
have a question.
So second,
Let me move the amendments and second it, and then I'll open it for concerns and questions, okay? So you move the amendments, there's a second by Hill. Now we open it for discussions. Go ahead.
Just a quick question. Did pharmacy technicians administer COVID-19 vaccines?
I believe they did. Yes,
So why are
Right.
they not allowed to do?
that's the
COVID-19?
compromise that was reached.
All right, I'll leave it there. Thank you.
Okay, any other questions, Delegate Hill? You're muted.
Sorry, I had to find the screen. So the compromises were agreed to by the Board of Pharmacy. Where was the nurses? I think it was the pediatric nurse practitioners. I assume they're off because it's not allowing it for pediatric patients, MedChi, MDAAP, and MACH. Did everyone agree with these changes or just the pharmacy board?
As far as I know, everyone agreed. The sponsor worked out the language specifically for the flu vaccine for adults to address concerns from the opposition.
Okay, so we're
So
not
as far as
sure.
I know that they are now okay with it.
Okay, can we find, I mean, we can vote it, can we just find out? So we can say that everybody, including the nurse practitioners, pediatric nurse practitioners and the MedChi and everybody are okay? I'm just asking, that's okay.
We can
Come on.
follow up and ask, and I'm gonna task Delegate Rosenberg with that, okay? Delegate Rosenberg, can you get that confirmation, please?
Understood.
Okay, and it's okay, Delegate Hill, this is where we do it, okay? Delegate Taveras.
And if possible, if they are not amenable, is it possible to kind of compromise to say, can we allow them to do this under emergency situations comparable to a pandemic?
They already compromised on these amendments, Delegate Taveras, and this is just to give you a little history. It's a little bit, what's the word that I'm going to look for?
Contentious?
It's a little bit contentious and this issue in this committee over the years. So if I can ask you respectfully, let's leave that for another session, okay?
Okay,
And I thank you for trusting me, all right?
no problem.
Thank you.
I'll also interject that if there is a state of emergency, the governor could authorize it.
That's perfect. Thank you.
Okay, thank you, Lindsay. So on the bill, actually, as amended, we did discuss, move the amendments. All those in favor say aye.
Aye.
Any opposition to the amendments? On the bill as amended?
Move the bills amended.
Second.
Second.
It's been moved and second. Any discussion on the bill as amended? All those in favor say aye. Any opposition? I see Delegate Shalega and Delegate Chisholm. And also Delegate Rosenberg, just find that out for Delegate Hill, okay?
Indeed.
All
I'll
right,
check with Delegate Kipke.
And
Thank
for me
you.
too.
all right, wonderful. Delegate Chisholm, do you have a question? Okay, thank you. All right, let's move on. We only have 3 more bills left. You guys, we're doing it, okay? We're almost done. So we have House Bill 716.
These are
And
easy.
that's Aaron, and that's Managed Care Organizations Acknowledgement of Responsibility for Payment of Retroactive Denial, Repeal of Applicability. And that is Aaron and Bagnell.
This bill alters the information that must be included in a written statement provided by a managed care organization to a healthcare provider when retroactively denying reimbursement as a result of coordination of benefits. There are amendments that were offered in the adopted in the Public Health and Minority Health Disparity Subcommittee that provide that if a retroactive denial of reimbursement is the result of coordination of benefits, a specified written statement by an MCO to a healthcare provider shall include the name and address of the entity identified by the MCO as responsible for payment of the claim.
Bagnell.
These amendments, thank you, Madam Chair. These amendments conform the bill to its cross-file, which passed the Senate Finance on the 3rd, and there was no opposition. Move the amendments.
All right,
Second.
It's been moved in second. Any discussion on House Bill 716 on the amendments? All right, seeing none, all those in favor say aye.
Aye.
Any opposition to the amendments? Seeing none on the bill as amended, may I have a
The bill is
motion,
amended.
please?
Second.
It's been moved in second. Is there a discussion on House Bill 716? Seeing none, all those in favor say aye.
Aye.
Any opposition? Raise your hand. Seeing none, the bill passes unanimous. Does anyone now want to be on this bill? Can you put your little hand up? I do not see that. Everyone is on it. House Bill 726, and then we have one more to go. Maryland Medical Assistance Program, Autism Waiver, Military Families, and that's Aaron and Bagnell.
This bill requires that a child on the registry for the waiver for children with autism spectrum disorder remain on the registry if the child's family relocates out of state for military service. If a child on the registry becomes eligible for services while the child's family is out of state for military service, the child must be eligible for services through the waiver if the family relocates to the state. There were no amendments.
Delegate Bagnell.
This was unanimous. I move the bill.
Okay.
Second.
It's been moved in second. Any discussion? All right. Seeing no discussion, all those in favor say aye.
Aye.
Any opposition? All right. It's unanimous. And then I have the last bill of the day, and then I have to go back to one, is House Bill 814. And that is Maryland Health Benefit Exchange. Actually, yeah, Maryland Health Benefit Exchange, state-based young adult health insurance subsidies pilot program, sunset of repeal. That's Lisa and Collison.
As amended, this bill extends the termination date of the state-based young adult health insurance subsidies pilot program rather than sunsetting it through calendar year 2025. The amendments extended for 2 years and require the exchange to study federal and state subsidies and whether the 1332 waiver should be amended to add young adults or otherwise to maximize federal pass-through funds to impact the most individuals and reduce the uninsured rate. Those amendments are on page 69.
Thank you, Lisa, for your work. You ladies, all three of you have worked very hard. Collison. Delegate Collison, you're muted.
Not often that I'm silent, so. As Lisa said, as amended, we see some benefit with this program, with the young adult subsidy program, in terms of the number of enrollees we have. I think the last I heard was 40,000 young adults who have signed up and have actually made a positive impact on our overall rates on our exchange, because when you put 40,000 young, healthy people into the pool, you have a positive effect on the entire premium structure. So that's to our benefit. But, we think that it's important for us to look at what this program outside of the context of COVID. So we've been living under the blanket of COVID for essentially 2.5 years, and things may be skewed. So this bill says, let's look at it with a more realistic kind of market where we can, find out, are the young people coming in because of the young adult subsidy, or are they coming in because it was COVID? And so we want to do a more complete study on how we maximize the use of our pass-through funds in our exchange and consider this program within that context. So with that, I move the amendments.
Thank you very much for your work.
Second.
There's a first and a second. Any discussion on these amendments? Seeing no discussion on the amendments, all those in favor say aye.
Aye. Aye.
Any opposition? Can you raise your little hand? Seeing no little hands. All right. All those in favor say aye.
Aye.
All right. Okay, no opposition. You can see that I did it twice. On the bill as amended. Is there a motion?
Move the bill as amended.
Is there a
Second.
second? Any discussion on the bill as amended? Delegate Shalega, is that for discussion on the bill as amended? Okay, no. All those in favor say aye.
Aye.
On the bill as amended, are there any opposition? Raise your little hand. Okay, Shalega, Chisholm, Riley, Morgan. Thank you so much. So this actually completes our work, but we're gonna go back to one bill, okay? And what happened was that we were having such an amazing rich discussion on 693 that I did not ask, does anyone want to be a co-sponsor of 693? Because it's favorable with amendment. And thank you, Lindsay, for letting me know. I appreciate you. Does anyone not want to be on Delegate Kipke's bill, the State Board of Pharmacy Board Membership and Delegated Pharmacy Act? If you don't want to be on that bill, please raise your hand.
Is that the vaccine bill?
Yes.
Yeah, I don't need to be on it.
All right, so I have Chisholm, Morgan, Riley, Shalega. All right,
Madam
thank
Chair.
you. So, yes, Delegate Ken Kerr, yes.
You didn't give an opportunity to sign on to 814 either.
A14, let's go back. A14, young adults. Who does not want to be on A14? Please raise your hand. Morgan, Shalega, Chisholm, and Riley. Thank you very much. And thank you, Delegate Care, for caring, okay? I'm not that tired. Okay,
All
Delegate
right.
Riley, do you have a question? Delegate
Madam
Riley,
Chair,
1 second, please. Delegate
Well,
Riley, your hand is up.
Nope.
Okay, Delegate Mandari.
yeah, could you ask this Lindsay, Erin, and if they have a secret outlet, they plug themselves into night like a phone charger? They're not tired.
Okay. Well, thank you, Delegate. That brought a smile. So I have
Quick
actually
question.
some things to discuss when we're done, just committee internal things. Actually, I'm gonna do it right now. Delegate Chisholm, is your hand still up?
I'll lower it. I just wanted to know where Ken Kerr was.
This is my
Backyard.
backyard where I am not currently.
And that's his real pizza oven that has his own house.
Okay, wonderful.
I don't know where
So-
Matt is, because he looked like he having too much fun.
So I'm just gonna, don't disconnect yet. We're done
Mom's
with
birthday.
voting. We actually are done with voting. So I have something that I want to personal, not to discuss. So I'm gonna take us off the air.